Hi, I'm Raymar B. Collado from Section Weidenbach. For this video, I will perform oral medication. But first, what is oral medication? It is the giving of medication to be swallowed through the mouth.
For the assessment, assess the appropriateness of the drug for the patient, review medical history, allergy assessment, and laboratory data that may influence drug administration, assess the patient's ability to swallow the medication, verify patient name, dose, route, and time of administration, assess the patient's knowledge of the medication and procedure. If the medications may affect the patient's vital signs, assess them for administration. If the medication is for pain relief, assess the patient's level before and after administration. For the objectives, first, to ensure the patient metabolizes medication without feeling of nausea or vomiting. Second, to offer the most common, easiest, and less expensive route of administering medication. Third or last, to provide a sustained drug action and increase absorption time. The equipment used for this procedure are medication in disposable cup or oral syringe, liquid, water, juice, etc. with straw if not contraindicated, medication cart or tray, medication card. Step 1. Gather equipment. Check medication order against the original physician orders according to agency policy. Clarify any inconsistencies. Check the patient's chart for allergies. This comparison helps to identify error that may have occurred when orders were transcribed. Step 2. Know the action, special nursing consideration, and safe dose ranges, purpose of administration, and adverse effect of the medication to be administered. Consider the appropriateness of the medication for this patient. This knowledge aids the nurse in evaluating the therapeutic effect of the medication in relation to the patient's disorder, and can also be used to educate the patient about the medication. And perform hand hygiene. Hand hygiene deters the spread of microorganisms. Step 3. Place medication on a tray or move the medication cart outside of the patient's room or prepare for administration in medication area. Organization facilitates error-free administration and saves time. Step 4. Transport medication to the patient's bedside carefully and keep the medication in sight at all times. Careful handling and close observation prevent accidental or deliberate disarrangement of medication. Step 5. Identify the patient by checking the name and identification on the patient's identification band or ask the patient to state his or her name. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Step 6. Explain procedure to the patient to gain cooperation and to allay anxiety. Step 7. Assess the patient to an upright or lateral position. Swallowing is facilitated by proper positioning. An upright or side-lying position protects the patient from aspiration. Step 8. Administer medication. Offer water or other permitted fluids with pills, capsules, tablets, and some liquid medication. Liquids facilitate swallowing of solid drugs. Some liquid drugs are intended to adhere to the pharyngeal area, in which case liquid is not offered with the medication. And ask whether the patient prefers to take the medication by hand or in a cup. This encourages the patient's participation in taking the medication. Step 9. Remain with the patient until each medication is swallowed. Never leave medication at the patient's bedside unless the nurse has seen the patient swallow the drug. The drug cannot be recorded as administered. The patient's chart is legal record. Only with a physician order can medication be left at the bedside. Step 10. Perform hand hygiene. Hand hygiene prevents spread of microorganisms and leave the patient in a comfortable position. Step 11. Check on the patient within 30 minutes or time appropriate for drugs to verify response to medication. This provides the opportunity for further documentation and additional assessment of effectiveness of pain relief and adverse effect of medication. Recording and charting. First, date and time of administration. Second, name of drug. Third, dosage amount and frequency. Fourth, route of administration. Fifth or last, signature of nurse administering of the drug. For the evaluation, first, patient is able to ingest and metabolize medication without feeling of nausea or vomiting. Second, patients emotionally accept medication. Third, desired therapeutic effect is obtained. Fourth or last, experiences no adverse effect including allergy response, systemic effect, or injury.